What supplements should you use while you're trying to conceive? I'm Dr. Sharon Moyeri, owner and founder of Fertility. Okay, so first and foremost, you just want to make sure you're taking a prenatal vitamin with DHA and folic acid, and you want to make sure you're taking the required amount. For singleton pregnancy, you want to take at least 1 milligram of folic acid, and you want to make sure that you're on at least 300 to 400 of DHA. There's instances you might need to take more if you have certain medical conditions. If you're having a twin pregnancy, these are things you want to talk with your doctor about. Last but not least, not really a supplement, but baby aspirin's commonly prescribed and given to women. It's an over-the-counter 81 milligram dose. Sometimes people recommend more than 81 milligrams. We give it often with our patients going through fertility treatment, especially if they're doing in vitro and or if they're older or have a certain history. And that's been shown to decrease the risk for preeclampsia and other complications related to pregnancies conceived in these situations. Should they be taking extra supplements? Should they be taking herbs? So there's pros and cons to all these questions. There's limited data for some of them. And so I really try to confine the supplements patients are taking to what's been evidence-based. First and foremost, my recommendation is always lifestyle. So you want to make sure you're maintaining a healthy diet and exercising and limiting things that are not good generally for our health. So limiting alcohol, no amount of tobacco or marijuana is considered safe. And then in terms of diet, you want to really limit animal proteins and stick with a high plant diet. For supplements, if you have, for instance, a vitamin D deficiency that's been demonstrated on blood work, obviously you want to supplement with vitamin D. Any other deficiencies you want to make sure that you're replacing. Vitamin B, magnesium may be hard to get through diet, so those might be things that you want to supplement in not excess amounts, but just what's required for your daily requirements. There's some evidence that maybe coenzyme Q10 might be helpful. Myo-inositol might be beneficial for women who are diagnosed with PCOS. Zinc and vitamin C might be useful as antioxidants for both men and women, especially for men who might have some male factor infertility. So there might be some beneficial role for some of these antioxidants in certain situations, and they're not likely to be harmful for most people as long as they're not taken in large quantities and within the daily requirements. DHEA is one of those other supplements that women with low ovarian reserve often ask about. It's probably not harmful. It could be useful. It's something if you want to try. I'm not opposed to trying. Herbs can be medicinal and therapeutic, but I'm always cautious with herbs because I really can't promote and know what's in the herbs. So you really have to trust the practitioner who's prescribing the herbs and make sure that you feel confident in terms of what they're giving you and how they're producing those herbs. So when it comes to supplements, I'm definitely open to considering certain supplements, but I want it to be limited and really in the context of a healthy diet and a healthy lifestyle, and sticking with some supplements that we generally feel are not harmful, and I would just stick with the list that we've discussed. There's a lot of information out there and misinformation about supplements, and you really want to be cautious because they can have some negative consequences as well, and the idea that they're always beneficial isn't true, and so you definitely want to talk to your doctor before you start taking a bunch of supplements.